The morning Walter couldn't get out of bed, that was the day I started paying attention in a different way. I'm 84 years old. I spent 32 years as a registered nurse. I have watched people do everything right and still get it wrong. And what I keep seeing, what I cannot stop thinking about, is how many of us are taking our medications exactly the way we were told to, following every instruction on the bottle, doing everything our doctor said, and still quietly, slowly making ourselves sicker. That's a hard thing to sit with, but it's true. And at my age, I don't have the patience for comfortable lies anymore. Let me tell you about a woman I worked with years ago. Sharp, organized, the kind of person who color codes her pill organizer. She was on thyroid medication. Had been for about 9 years. She did everything right. Took it first thing in the morning, every single day, never missed a dose, and yet her thyroid numbers kept bouncing around. She was exhausted. She was gaining weight despite watching what she ate. She went back to her doctor 3 times. Every time they adjusted her dose. Every time things would stabilize briefly, then drift again. What nobody ever asked her, and I mean nobody, was what she was doing in those first few minutes after she swallowed that pill. Turns out she was taking it with her morning coffee. Every morning for 9 years. And I want you to understand something. This is not a minor inconvenience. When you take levothyroxine, thyroid medication, with coffee or with food, you can lose anywhere from 40 to 60% of its absorption. The pill goes in. Your body barely sees it. You're essentially getting half a dose every single morning, while your doctor keeps adjusting numbers that were never going to be stable in the first place. The fix is not complicated. Take it with a full glass of water, 30 to 60 minutes before you eat anything. Or, and this is something newer research has actually confirmed, take it at bedtime, at least 3 hours after your last meal. Works just as well. Saves you from that miserable morning wait. She switched to bedtime. 3 months later, her numbers were the most stable they'd been in nearly a decade. Now here's what I want you to hold on to, because this is the part that's easy to miss. It wasn't about the medication being wrong. The medication was right. The dose was right. The timing was wrong. And nobody, not the prescribing doctor, not the pharmacist who handed her the bag, nobody ever told her that the timing mattered that much. I think about that when I hear people say they've tried a medication and it just didn't work. Sometimes that's true, but sometimes the medication worked exactly as designed, and the window it needed to work was something we were accidentally closing every single morning. Walter's been on a statin for about 12 years now. I won't name the specific one, but I will tell you that for the first several years he was taking it at breakfast, because that's what the label said. That's what his cardiologist told him. Morning with food. Fine. What that cardiologist never mentioned, and I only found this out because I still read the journals, even in retirement, is that your liver produces the most cholesterol between midnight and 3 in the morning. Not during the day, in the middle of the night while you're asleep. So if the whole point of a statin is to slow down cholesterol production in the liver, and you're taking it at 7 in the morning, you're asking it to do its job at the wrong time of day. Some of the older statins, the ones metabolized faster, lose up to 30% of their effectiveness when taken in the morning versus at night. We switched Walter to evening dosing, talked to his doctor about it first. His LDL numbers came down noticeably within the next blood panel, and we hadn't changed anything else. The timing, that's all. I want to tell you about someone else now, because this one still bothers me. A neighbor of mine, older woman, lives alone, takes her health very seriously. She was on an iron supplement because her ferritin kept coming back low. She was also taking calcium because her doctor recommended it for bone density. She bought both. She took both every morning together like a good patient. And her ferritin levels barely moved for 2 years. She told me this over the fence one afternoon, a little defeated about it, wondering if there was something wrong with her gut. And I had to ask her, "Are you taking those 2 supplements at the same time?" She looked at me like I'd just spoken another language. Yes, of course. Same handful every morning. Iron and calcium compete for the exact same absorption pathways in your gut. They are fighting each other every time you swallow them together. You might as well be taking half of each. Separate them by at least 2 hours. And if you can, take your iron with a small glass of orange juice. Vitamin C can actually double your absorption. What kills it? Dairy, coffee, antacids, which, incidentally, many people over 50 take every single morning. So you have a situation where someone is diligently taking their iron supplement, washing it down with their morning routine, and wondering why the numbers never improve. She started spacing them out. Her ferritin came up for the first time in years. Now I need to stop here and tell you something because we're about to get into the part that I find genuinely alarming. And I mean that. This next one. When I read the research on this, I sat with it for a while before I talked to anyone about it. Most people with high blood pressure are told to take their medication in the morning. It's on the bottle. It's what the doctor says. And for a long time, that was considered the standard. You take it in the morning. You start the day protected. That's how it works. A large study, and when I say large, I mean over 19,000 patients, followed people for years to look at whether it mattered whether you took blood pressure medication in the morning or at bedtime. What they found was not a modest difference. People who took at least one of their blood pressure medications at bedtime had a 45% reduction in heart attacks, strokes, and cardiovascular death compared to those who took everything in the morning. 45%. And yet most prescriptions still print "take in the morning," because that's what has always been printed, because changing habits in medicine is slow, and the patients waiting for those habits to change sometimes run out of time first. I'm not telling you to change your medication on your own. Please don't do that. What I'm telling you is that this is a conversation worth having with your doctor. Specifically worth having. Write it down before you go in. Ask whether bedtime dosing is appropriate for the specific medications you're on, because not all of them work the same way. But have the conversation. Don't assume the default is the optimal. Speaking of defaults that never get revisited, let me talk about acid reflux medication, because this is one that I saw over and over again in my nursing years, and it hasn't gotten better. Proton pump inhibitors, the medications for acid reflux, the ones so many people take every morning, were designed to be used for 8 to 14 weeks. That's what the research supported. That's what they were approved for. Short-term relief, a way to let an irritated esophagus heal. But what happens in practice is that someone starts taking one, it works, they feel better. Nobody schedules a follow-up specifically to step them down off of it, and 3 years later they're still on it, sometimes 10 years, sometimes more. Long-term use of these medications has been associated with magnesium depletion, increased fracture risk, around 35% higher for hip fractures in some studies, and in older adults, there are now connections being investigated with kidney function and cognitive changes. That's not something to panic about, but it is something to pay attention to. Ask your doctor when you're meant to stop, or whether there's a lower level option that might be appropriate for you. Because for a lot of people, what started as a short-term fix became a permanent prescription that nobody ever reviewed. Now here's the one that sounds almost too simple, too obvious, but I promise you it is sending people to the emergency room. How much water do you use when you swallow a pill? Most people use a small sip, just enough to get it down. And I understand, you're busy. It's muscle memory. You've been doing it that way for years. The problem is that tablets and capsules can stick. And when they stick in the esophagus, they don't just cause a little discomfort. Certain medications, and I'm thinking of antibiotics, aspirin, medications for bone density, can cause chemical burns in the tissue, actual burns that mimic the symptoms of a heart attack, chest pain, pressure, difficulty swallowing. Thousands of older adults end up in emergency rooms every year because a pill sat in the wrong place for too long. The correct way to swallow a pill is with at least 8 ounces of water, while you are sitting upright or standing, and then staying upright for at least 30 minutes afterward, not lying down, not reclining in a chair, upright. That's it. 8 ounces, upright, 30 minutes. And it matters enormously for certain medications specifically, including some of the most commonly prescribed ones in people over 50. Let me tell you something now that sounds like it belongs in a thriller, not a health conversation. There is something in your refrigerator that may be interacting with your prescription right now. Not something obscure, not some supplement you ordered online. Something most people consider a healthy choice. Grapefruit. Grapefruit and grapefruit juice affects a liver enzyme that processes over 85 common medications. Statins, certain blood pressure drugs, some anti-anxiety medications. When grapefruit blocks that enzyme, those drugs don't get broken down the way they should. They build up. Their levels in your bloodstream can become significantly higher than your prescribed dose was designed to produce, which means a drug that was calibrated to help you can suddenly behave like an overdose. And here's the thing that stops me every time I think about it. 1 glass of grapefruit juice can suppress that enzyme for up to 72 hours. Not a few hours, 3 days. So if you think you're being careful by just not having grapefruit on the days you take your medication, that's not enough, not nearly enough. Ask your pharmacist whether any of your medications interact with grapefruit. It should be on the label if it does. But people don't always read those inserts. I didn't always read them as carefully as I should have, and I was a nurse. 2 more things, and then I want to come back to something I mentioned earlier. If you or anyone you know has ever taken a kitchen knife to a pill because the dose seemed too high, or you were trying to stretch a prescription further, Please hear me on this. Splitting a pill that isn't scored for splitting, that doesn't have that little line down the middle specifically designed for it, creates fragments that can vary by 20% or more in actual drug content. One half might contain most of the medication, the other might contain almost none. For most everyday things, that's not catastrophic. But for blood thinners, for heart medications, for thyroid drugs, a 20% swing in either direction is not a minor variation. It is the difference between the drug working, the drug failing, or the drug doing harm. Before you split any pill, ask your pharmacist whether that specific medication is approved for splitting. Not all of them are, and a pharmacist will tell you. That's exactly what they're there for. And this last one, take with food, that instruction on the bottle. I want to talk about what it actually means because I think most people interpret it as a full meal. Sit down, have your breakfast, then take your pill. And for some medications, that's fine. But for others, a heavy meal actually slows down stomach emptying significantly enough that it can push the timing of your drug's peak effectiveness hours off schedule. You're taking your blood pressure medication or your diabetes medication. It's supposed to do its job at a specific time, and instead it arrives late because it had to wait in line behind a heavy breakfast. What take with food usually means, for absorption purposes, is a small amount of fat, a few crackers with a little cheese, a spoonful of peanut butter, something. Not a full meal, something to activate the right absorption pathway and protect the stomach lining. That's enough for most of them. You don't need to sit down to a 3-course meal every time a bottle tells you to take a pill with food. Now, I want to come back to Walter for a moment, because that morning I mentioned at the beginning, the morning he couldn't get out of bed, part of what I found when I really looked at his medication list was exactly this: timing issues, interaction issues, instructions that were never explained. He had been a careful, cooperative patient his entire life, and he was still quietly being failed by the gap between what the prescription said and what anyone ever explained about how these things actually work. I sat at the kitchen table that morning with his pill bottles lined up in front of me, and I went through every single one. I called the pharmacy. I called his doctor. I am a retired nurse with over 3 decades of experience, and I still learned things that week that I had not known before. That tells you something. If I didn't know, there's no reason to expect that you knew either. There's no shame in that. The shame would be in not asking, now that you're aware. The thing I want to leave you with is this. Your doctor is not trying to mislead you. Your pharmacist is not withholding information out of indifference. But medicine has habits built up over decades, and instructions get passed down the same way. And nobody has time in a 15-minute appointment to go through every nuance of how each of your 7 medications should ideally be timed, spaced, and swallowed. That gap between what would be ideal and what gets communicated is where a lot of the damage happens, quietly, over years. You are not a passive bystander in your own care. You are allowed to ask questions. You are allowed to bring a list to your next appointment. You are allowed to call the pharmacy and ask the pharmacist specifically about timing and interactions for every single thing you're taking. That is their job, and most of them are very good at it, and most of them are underused. You have time to get this right. Use it. If any of this brought up questions about someone you love, a parent, a spouse, a friend, who's been struggling with medications that don't seem to be working the way they should, share this with them. Sometimes the information finds the right person at exactly the right moment. If it found you today, I hope you'll pass it along. And if you want more of these conversations, I'll be here. Leave me a comment about which of these surprised you most. I read every single one.